Hi everyone, I'm Andrea Donsky, co-founder of Naturally Savvy, and today I'm here with Philip Rouchotas, a naturopathic doctor who is brilliant and all about the science. So Philip, I'd love you to do a quick introduction on yourself because you were telling me about all the different things that you do and you specialize in, and I thought it would be great for you to introduce yourself.
Thank you very much for having me, Andrea. It's a treat to be here. My wife and I are both naturopathic doctors who practice in Bolton, Ontario. My wife principally works in the world of advanced cancer, a very tough area to work in. I principally work in the world of mental health. I've been teaching the second year curriculum in clinical nutrition at the Canadian College of Naturopathic Medicine since 2004. It surprises me sometimes to think it's been that long, but it has been, and excited to talk about what we're here to discuss today.
We're going to talk about natural supplements and the science behind them. We're going to talk about vitamin D, probiotics, and green tea. So let's start with probiotics. Now, given that with the situation that we're in self-isolation and what's going on in the world, I thought we could focus on the research behind probiotics and immune support and anything else that you want to talk about when it comes to the research itself. So let's start in the area of probiotics.
It's a exciting area to talk about. It's almost insurmountable, the magnitude of published human level science on probiotics. And what we're keying in on with what's going on is things that have human level evidence to show that they can be antiviral. Want to make it really, really clear. We cannot specifically talk about COVID. We have no data on COVID yet, right? It's so new. No one's done the research. Trials are ramping up, including on natural medicines, to look at what may be useful against this viral pathogen. But we've got a lot of human level evidence of natural medicines impacting seasonal influenza. So when I'm talked about, hey, what has human level science for impacting viral, we turn to seasonal influenza, right? Scientists are not dumb. And so when they research these things, they research what are generally considered high-risk populations, that being the very elderly or the very young. I realize in our current pandemic, the very young seem to be being spared, which is obviously good. But as far as the three agents we're talking about today, probiotics, vitamin D, and green tea, the evidence relates to preventing and or treating seasonal influenza. And most of the human level evidence comes from, again, either the very elderly or the very young. So when we turn to probiotics, they are, you started with the toughest one. We could do 10 hours just on probiotics. It's really a fascinating topic. How about just a little brain teaser, all right? We're talking about live bacteria that live in our intestines, small and large intestine predominantly. There's a little bit in your stomach, but small, large intestine is where they make their home. There are 10 times more bacteria in our GI tract than there are cells in our body. Like, think about that for a moment. It's just a staggering concept. And what these things do, I think most of your viewers will be aware that the majority of our immune system resides in our gut. And then so I always ask a little quiz. Okay, so does our immune system live in our stomach, our small intestine, or our large intestine? And the answer is the majority of our immune system is residing within our small intestine. So then you have these massive populations of bacteria, the microbiome. This is what we refer to as, we are altering the microbiome when we take probiotics, right? So these live bacteria that live in our gut, and they are intimately interacting with our immune system. So normally, obviously, these bacteria, they are not self. They are foreign, right? They are different bacteria. They are different from our own body cells. And normally, our immune system would ramp itself up to fight these things. But because of this interaction they have with our immune system in the small intestine, what they achieve is a really wonderful term called immune tolerance. They basically teach our immune system, calm down, okay? So what is a seasonal allergy? You've lost immune tolerance. You walk outside, something that's supposed to be in the environment, like a pollen or a grass or whatever it is, it's supposed to be there, but now it triggers your immune system. You've lost immunological tolerance to that normal member of your environment. Probiotics help us maintain that tolerance. Well, what does that have to do with antiviral? Nothing. You could almost argue that's slowing down immunity. It's making us not react. At the same time, and that's what makes these bacteria so remarkable, they are shutting down subsets of immunity that overexcite our immune system. But at the same time, they are ramping up subsets of immunity that help us fight foreign infection, right? It's remarkable. You pick the one that is just, it's almost magical when you talk about probiotics and what they can do. And we haven't even touched on the gut health effects yet, like what happens when somebody with inflammatory bowel disease takes a probiotic. New science on probiotics is looking at their impact on mental health. You in fact have more serotonin in your GI tract than you have in your brain. And these bugs are intimately interacting with GI-derived neurotransmitters, signal molecules, and they're being shown to have direct effect on anxiety and mood in humans. It's just this endless parade of wonderful findings that we're getting in the world of probiotics. So to bring all this back to antiviral, multiple human studies of either walking into long-term care facilities or walking into like preschools and doing human studies where we say placebo versus probiotic, looking at the incidence and severity of seasonal influenza. And any environment we're walking into, the probiotics are showing that they are reducing the likelihood of getting influenza, and if you get it, they are reducing its severity. No brainer. On top of that, there is further evidence that says if you get vaccinated, if you get the seasonal influenza vaccine, taking probiotic versus taking placebo, the probiotic helps you better, the term is seroconvert. It basically means you reacted more appropriately to the vaccine. You were more successful at making antibodies to why you were taking the vaccine. That is improved if you're taking probiotic versus placebo.
I have many questions around dosage type, when it comes to taking probiotics. So what you're saying about kids and it helping with boosting immunity for kids in schools, but even for adults. And we're also, you're talking about the mental health. I have all these questions. I mean, first of all, yes, the mental health aspect, the gut-brain connection, it's so huge. I know myself, when I take my probiotics, my anxiety is less. I absolutely love that there is science on that and that it really helps. So let's talk about dosage. How much should we be taking? We'll start with, with the antiviral component of it. What should we be taking and how much should we be taking? Is it an everyday thing? Is it a couple times a week?
Regarding probiotics, the marketplace can be a bit of a scary place for consumers, I think, because you walk into an average health food store, you sit in front of some big, huge refrigerator with 1,000 different probiotics, and the dosages range from 1 or 2 billion to as high as 150 billion. And these numbers sound staggering, right? So when we talk about dose, let's go back to, there's a reason I've already discussed small intestine, large intestine. You have to ask yourself, what are you trying to do when you take it? And the answer is you are trying to impact the population in the small intestine. That's where the magic is happening. That's where the interaction with the immune system is occurring, right? So then the question is, how many bugs normally live there? The small intestine has 10 to 100 billion. It's a big number. The large intestine has 10 to 100 trillion. Wow. So I'm just going to say regarding dose, one point you want to make about probiotics, it is preferred if you find one that is enteric coated. What that means is this capsule will not open until it hits your small intestine. These are live bugs. They don't like stomach acid. They can't survive. Like if you take your hand and physically put it into your stomach, you wouldn't have a hand left. That is the potency of stomach acid, right? So these live bugs don't like it. So enteric coating is definitely something to keep in mind when looking for a probiotic. Then dose. Most people are taking a probiotic to influence the small intestine. The dose required to do that, 10 billion, 11 billion, 15 billion, something in that range, really common to find, very cost effective. You're going to have a very powerful impact on the small intestine. The massive dose ones out there, I think it's being overdone a bit. They are certainly safe. You cannot hurt yourself with a high dose probiotic. No, that's been very clearly shown. We have human studies giving doses of probiotics that you almost can't get on the market. Like you'd have to take entire bottles of high dose probiotics. That's been looked at in human studies. But we reserve the really high dose when you know the problem is in the large intestine, when you know you have a disease in the colon, because there's 10 to 100 trillion of them in there. Putting 10 billion into a population of 50 trillion isn't really going to do much. But putting 10 billion into a population of 50 billion that's in your small intestine, that's going to have a very big effect. I hope that makes sense. So generally 10, 11, 15, 20 billion, this is the kind of range where I think you're getting a fantastic probiotic effect. It's very cost effective. Keep in mind, it should be enteric coated, and keep in mind, it should be refrigerated. I am skeptical whenever I see a probiotic that says I am shelf stable. I don't have much faith in that. So we want to see them in a refrigerator, and ideally enteric coated. 10, 20 billion range, I think is a good place to play.
Okay, thank you for that. Let's move on to vitamin D. What is the research behind vitamin D, specifically when it comes to viruses?
Right. So you're right. It's a panacea of benefits that we get from vitamin D. Bone health, certainly. Mental health, absolutely. Observational evidence, that's not the placebo-controlled human trial, but it's an observation that Canadians have the highest rates of multiple sclerosis in the world. And part of that is deemed to be linked to our generally lower levels of vitamin D due to lower levels of sun exposure, right? This is the one and only supplement that has ever appeared in the Canadian Food Guide as Canadians should take vitamin D, right? That's a very big thing to say. What doesn't it do? Specifically regarding viral, again, we're not specifically talking about COVID. We don't have evidence regarding COVID-19 for natural medicines yet. So our evidence is coming from seasonal influenza. The scientists aren't dumb. They're looking at very young children and the elderly, generally considered higher risk groups. So again, we walk into a preschool or we walk into a long-term care facility, we give vitamin D versus placebo through flu season, and we track what happens. And if you're taking vitamin D, you are less likely to get the flu. And if you get it, it is less severe. So this has been reproducibly shown, multiple human studies, not to mention all the other benefits that come along with taking vitamin D, which are profound. And the cost effectiveness of vitamin D is ridiculous. Like you're going to pay, I don't know, $10 to $15 for the product, and it's going to last one person over a year. So this really is.
How much should we be taking of vitamin D? I've heard different opinions on it. We know that the recommended dosage, I believe, is lower than some of the experts who are saying we should take a little bit of a higher dosage. And can we overdose? Like, can we take too much vitamin D?
You absolutely can take too much vitamin D. And I think in the industry, I'm a little alarmed when I see people just randomly telling people, oh, no, take like 10,000 IU a day or whatnot. I think that is really way too much. You should be measuring. Once a year, once every other year. It's not that expensive of a test. Please measure. Blood level needs to be between 75 nanomole per mil and 225. It can go too high, and that can be problematic. 1,000 IU a day is a pretty standard adult dose. If you're measuring, there may be cause to go a little higher, but little higher. And I really have issues with people taking massive doses of vitamin D without following up with any testing.
Oh, I'm a big fan of testing and understanding where your blood levels are at and then adjusting it accordingly. So I'm really happy that you said that. And you're right. I think, is it $35? It's between $35 and $50 to have the test done. And I do think it's one of those every single year. We should all have our vitamin D test done. And why is that important, Philip? So if we are insufficient in vitamin D, why is that something that we should work towards making sure we're getting into that right range?
This is a really interesting area. For many years, as an aside, you mentioned rickets. For many years, what the blood level of vitamin D was supposed to be was the bare minimum to prevent rickets. So that was 20 nanomole per mil. And we realized, okay, under 20, you start getting clear bone disease. Like that's clear, severe deficiency. Interestingly, I give a talk and I treat children with ADD. And a study looked at about 2,000 kids, measured various nutrients. 20% of kids diagnosed with ADD had a blood vitamin D under 20, like the very severe level of vitamin D deficiency. Brutal, right? But we realized so many years ago, the guideline went from blood vitamin D should be greater than 20 to blood vitamin D needs to be greater than 75. And essentially, if you're not supplementing vitamin D, you are deficient. That's a statement of fact. I do not think it's possible to be adequate by the current definition in vitamin D without supplementing it, right? And what we realized is, okay, less than 20, you get rickets, but if you're greater than 50 versus 25, here's this slew of benefits you get. And then if it's greater than 60 versus 25, here's this further additional benefit you get. So there's a spectrum of benefit as the blood level of this goes up, but it is a fat soluble vitamin and it can get too high. You store this, you have a hard time getting rid of it. So if you're taking these massive, massive doses long term, that can cause problems. But again, a panacea of benefit, impacting cancer risk, impacting heart disease risk, very definitely impacting mental health and impacting immune function. We're focusing on influenza as our talk today, but it helps arthritis. You have joint pain, you start taking vitamin D. That's been shown to reduce joint pain in people with arthritis. So it helps skin disease like psoriasis and eczema. So a radical panacea of benefit from vitamin D. It's one of the probiotics and vitamin D. In my opinion, there is this very, very short list of supplements that you can basically tell people, all people should take these. And two of them are probiotics and vitamin D. And it's a ridiculously short list. The list probably ends with fish oil. You'd almost stop there. Probiotics, vitamin D, fish oil are things you could kind of tell everyone, hey, all three of them have this broad spectrum of benefit that they deliver. Like hundreds, thousands of human studies on each of these ingredients regarding these different benefits we're discussing. The fish oil does not have any antiviral impact, and that's why we're not really talking about it today. But the vitamin D and probiotics have clearly demonstrated this in well-controlled human trials, and that's what we've been discussing.
We just have to do another interview where we talk about fish oil.
I have a master's degree in fish oil. I can
right on.
Time for that interview. I could go off on fish oil for quite a while.
Good, and I happen to love fish oil, so that's great. The omega-3s. Now, when it comes to form for vitamin D, there's liquid. I've seen gel caps, and I've also seen it in little tablets. Is there a specific form that's better to take when it comes to absorption than others?
Clearly shown, any and all forms are equivalent. You want vitamin D3, there's no superiority over liquid versus tablet versus capsule. It's very readily absorbed. We absorb it very efficiently. No, I would say dosage form doesn't really seem to matter for vitamin D.
And what about vitamin D2 for people who are vegan and don't want to take the vitamin D3 format?
Forgive me, you might edit this out. I say take the D3.
Really? So the research shows that the D3 is better absorbed, and by how much?
Better utilized. Like you have to do, D2 requires a biological conversion to become active versus D3, you're already consuming the active form. There's some discussion about this in the realm of B-complex vitamins, active versus non-active, and just feeding the active form is generally considered always superior.
All right, so let's talk about green tea. Green tea, I know, is great for so many different things, but how is it specifically good for when it comes to viruses?
Again, no specific mention of COVID-19. We don't have human evidence for that. We're talking about seasonal influenza, and this is the one I'm most excited to talk about today. Probiotics and vitamin D, we can talk about them for hours and hours. They're wonderful agents with a panacea of benefit. Green tea, we first consider it, basically it's a great antioxidant. I think that term is overused, but there's a difference between what works as an antioxidant in a test tube versus what works as an antioxidant in the human body. And that is a really big difference. In fact, the most potent antioxidant on the planet by far, nothing compares. With a big smile on my face, women usually love hearing this one. It's dark chocolate. Dark chocolate is the king. Nothing touches dark chocolate when it comes to being an antioxidant. Tier 2 is green tea and berries. Okay, so we love it for that. It's shown some interesting stuff, may help weight loss, which is always an interesting outcome for people. I have issues with that whole industry. I think a lot of things are touted for helping weight loss that really don't have any evidence that they have an impact, whereas green tea does. But why we're here talking about it today, this is a really potent antiviral. I can't stress this enough. You know, when people were doing their panic buying, I went and bought like 5 boxes of green tea. Okay. Can't stress enough how potent of an antiviral this is. Before we get into influenza, let's go to a totally different area. There is a prescription cream for warts. So warts is human papilloma virus, right? So warts are viral. There's a prescription cream to treat warts where the only active ingredient in the cream is green tea extract. This is a ridiculously potent antiviral. What I'm about to say is not strong scientifically at all. This is N equals 1. Recently, right before COVID hit, I had a patient come in my office with shingles. So shingles is a reemergence of chickenpox virus. It sort of lies dormant on your nerves, and it reemerges later in life. So here it's horribly painful, it's horribly itchy, horribly uncomfortable. So older gentleman comes in with shingles. And the only thing I could think of, well, I know this is viral, what do I got? I told him to do topical green tea. Make a strong green tea, strong, multiple bags, soak a clean rag in it, put it on. The gentleman came back and for a follow-up and told me, he goes, within an hour of putting it on, all my symptoms were gone. No more itching, no more pain, no more discomfort. And within about 6-7 days, his lesions were like 90% resolved. So It's one case, and it's 1, N equals 1, but I'm trying to tell everyone about it because I'd love to get more feedback from colleagues and patients that are trying topical green tea for shingles. It is just one case, but what that did absolutely blew my mind. Wow. So then we've got influenza. Again, we got multiple human studies on purpose going into high-risk populations, the very young and the elderly, green tea versus placebo. My favorite study on this was a pretty big study that actually looked at nurses. So it gathered up a big number of nurses. They all get the flu shot. They're occupationally required. They all got the flu shot. And then they asked, okay, green tea versus placebo, 9 months. How many nurses get the flu and how severe was it? So even if you get the flu shot, some people still get the flu, obviously. And the green tea very significantly reduced the likelihood of these nurses getting the flu. And if they got the flu, it reduced its severity. So we've got a total of about 8 human studies looking at green tea for preventing and or treating seasonal influenza. Most of the studies showing very important benefit.
Now, when it comes to green tea, is it the ingredient, is it EGCG that is responsible for that? What is it in green tea that makes it so potent?
I would say EGCG seems important, but you don't want to just take like a pure EGCG extract, right? We don't know the exact active constituent. A lot of these studies are using actually drinking of green tea. A couple of them are using green tea as a gargle. So they get people to make the green tea and gargle it. And that's what some of these studies do. So green tea, the thing is, supplements like to standardize to green tea, to EGCG, which is wonderful. It is an important constituent in the green tea. But that is still a whole green tea extract that happens to be standardized. So the assumption is the supplement is likely to deliver the same outcomes we've been discussing from the green tea itself.
So I guess let's go back a minute to the supplements versus drinking the tea. So you believe that whether we're drinking the tea or taking a supplement, it'll be just as effective, or are there certain applications where we would need a supplement versus drinking the tea?
I think both are going to deliver similar outcomes. It's a dose thing, though. It's a dose thing. Like some of these supplements are pretty concentrated. They can be the equivalent of 3 or 4 cups of green tea. So that's where the debate can come in. And there is, like, of these studies I'm mentioning, at least one for sure did use supplement rather than drinking green tea and did show benefit for seasonal influenza. So I would say benefit has been shown for both forms.
My question always comes down to, and I'm a nutritionist, so I'm obviously a big fan of both food and supplements. My question is, can we get enough by drinking the green tea alone? And so it's interesting to hear you say that you're saying in many cases we can get similar benefits, I guess.
Yeah. A couple cups a day of green tea, I would say, is what we're talking about for these benefits to seasonal influenza.
Specifically to seasonal influenza. So that's 2 cups a day, just so we have clarity.
Absolutely.
And does it matter when we drink it? Does it have to be with food, in the morning, without
No,
food?
I wouldn't. Generally, natural health product supplements should always be taken with food. That's a big message I put out there. A lot of people are promoting not to take it with food. That's not the way to go. It's about the way absorption, most digestion and almost all absorption happens in the small intestine. And it's about how you present this to the small intestine. And the way it expects to be presented is as a food bolus. That's when it kicks in, right? It starts from when you put something in your mouth. There are signals triggering things to turn on. That food bolus makes its way through your stomach. It reaches the small intestine, and that's where digestion and absorption takes place. So if you just put this random pill without any food in there, that's when you compromise absorption. Like we have great evidence on this fish oil. You double the absorption of fish oil if you take it with food.
Well, that makes sense too, because it's fat, right? It's an oil. So you want to take any type of your oil-based supplements, like even vitamin D is an oil-based supplement, right? So the fat, so you want to take that with food. But is it the same, let's say when you take vitamin C, which is a water soluble?
I would still say you take it with food. Otherwise, it's just vitamin C on its own in your intestine. And it's going to take a lot longer to get there without the stimulus of the food bolus to get it to your small intestine. And I don't think your small intestine is really prepared to absorb that. Generally, natural health products are better absorbed with food. But green tea can totally just be taken on its own, right? Yeah. It's a liquid. It'll get in there. It'll get to where it needs to go and do its job.
One thing I noticed with green tea,
a green tea pill, I would certainly be taking that with food.
With food. One thing I noticed when drinking green tea is if you leave it, you're leaving the tea bag in the cup for too long, what happens is all the tannins get released. And if you drink it on an empty stomach, it could make you nauseous. It was happening to me. And then I told my mom about it and she was getting nauseous too. And it got rid of her nausea. So just a little tip when it comes to drinking green tea is, just follow the directions on the label and then make sure that you're drinking. If it's, high in tannins, just make sure you're drinking it with something that you're eating it with food.
That is really interesting because I leave the tea bag in the whole time I drink it and it doesn't bug me, but I can respect that some people that might bother. So I'm a big fan of making it strong, yet that's very interesting what you're highlighting there.
Yeah, for some people, it can really lead to nausea. So so drink it with food was what I was trying to say. Is there anything else around green tea that we didn't discuss today that you'd like to share?
No, I think we're good. Green tea is good stuff, and safety of everything we're talking about. Like, hey, green tea has been consumed in very large quantities in several parts of the world for millennia. These are things that inherently you have this unquestioned magnitude of safety regarding. Simply because humans have been consuming it in large quantities for almost eternity.
I have a question regarding green tea and hormones. And I had heard that if you take, I guess it was because maybe the EGCG, but if you take green tea and you have, let's say your genetics, you make more estrogen or quicker estrogen and it doesn't go out as quickly, that green tea can actually elevate I think it's maybe testosterone levels, or it has some type of negative impact on hormones. Have you ever heard that? No,
I have not. And it woid be worthwhile to investigate that, but I have not seen green tea impacting hormone levels. An aside is bone formulas. The one natural medicine that clearly has been shown to have direct impact on estrogen levels is boron. And a lot of bone supplements contain boron. So that's something to be aware. And Health Canada has mandated that any product containing boron has warnings on it about breast cancer risk. Boron quite aggressively increases circulating estrogen.
Hey, that's good to know.
Not heard about green tea having effects on hormone levels. Just because I haven't heard of it doesn't mean it's not true, but I am not aware of that.
Thank you for sharing. Well, thank you so much for speaking with us today, Philip. It was really interesting, very informative. I love that you cite the research and you live in the research, which is great. So I appreciate you being on our show today. So thank you.
I'm grateful to you for having us on. And if there's an opportunity to do it again, we'd be very excited. Stay safe and hope to see you soon.